Magandang araw po mga kaibigan. Tayo po'y magkakasama ngayong araw na ito ng linggo sapagkat marami tayong mapapag-usapan. May kinalaman po naman ito sa sitwasyon ng ating bansa at ng ating daigdig. Noong pong nakalipas na Biyernes o kamakalawa, sinabi ng Asian Development Bank na apektado ng COVID-19 ang iba't ibang ekonomiya sa buong daigdig, kahit na rin dito sa Asia. Partikular na tatamaan ang sinasabing developing member countries na kinabibilangan ng Pilipinas. Apektado ang gross domestic product for the year at makakabawi lamang ang ekonomiya kung gagawin ng mga pamahalaan ang mga angkop na hakbang. Sa isang briefing nga noong Biyernes, nabanggit din ng Asian Development Bank ng kanilang chief economist na apektado rin ang supply chain. Kaninang umaga, samantalang ako'y nagkakape, napakinggan ko ang report ng Al Jazeera tungkol sa panayam nila sa Medicine Sans Frontiers. At sinabi ng kanilang resource person na samantalang may mga gamot, ang problema ay paano maihatid ang gamot sa mga apektadong lugar, lalo pa at may problema sa transportasyon. Sa ganitong pagkakataon mga kaibigan, minabuti ko po na makasama natin sa ating special focus sa COVID-19, ang mga may kinalaman sa industriya. We're joined by Dr. Beaver Temesis, Pangulo po naman ng Pharmaceutical Association of the Philippines. Narito rin si Ms. Jeanette Hacosalem, Presidente ng PHAPCares Foundation. At ito po yung Corporate Social Responsibility Arm ng PHAP at siya rin ang nangangasiwa sa Metro Drug. At ang Executive Director ng PHAP na si Ginoong Ted Padilla. May mga kasama na tayong mga media at ganun din po naman ang ating mga kasama sa Facebook na maaaring magtanong in a short while. Siguro to start the ball rolling, we will have short statements from Dr. Beaver, Jeanette, and Ted. Let's start. Dr. Beaver, how is it today?
Magandang hapon po sa lahat. Melo, thank you everybody for inviting us to join this meeting. Siyempre, this is a crisis and it's also a very trying time for everybody, lalo na rin sa industriya namin. We at PHAP continue to strive to make sure that one, continues ang research ng mga companies namin to try to find the right treatment, the right cure to help manage this crisis. Pangalawa, more importantly dito sa malamang sa atin is to make sure na lagi tayo may supply ng gamot, ng mga essential drugs natin. Not just the drugs that are being used for treatment of COVID-19, but to also make sure that everybody else has a continuous supply of their own drugs na regular na dapat nila iniinom. And of course, yung distribution, yan ang the most critical part now that's actually starting to affect all of us. How do we get the product from the ports to the warehouses, hanggang makakarating sa mga retail drugstores in your hometown. So these are the top concerns that we all have right now, and I'm glad that we're having this forum. So thank you very much for inviting us today.
Very good. Thank you very much, Dr. Beaver. Let's hear from Jeanette. Jeanette.
Hello. Good afternoon, Melo. I'm pleased to be joining you in this forum. My name is Janet Hacosalem. I am the president of PHAPCares Foundation. And as you mentioned earlier, Melo, we are the corporate social responsibility arm of PHAP. This pandemic is really unprecedented. No? It has posed several challenges in the supply of medicines globally and of course in the Philippines. PHAP is coordinating efforts with the government for concerted actions to contain the spread of COVID-19, mitigate its effects, and impact on the nation as a whole. PHAP members are helping in any way we can for an uninterrupted supply of medicines needed for the management of COVID-19, but also of other conditions like hypertension, cancer, diabetes, respiratory diseases. Despite the risks as well as the added challenges of varying local ordinances and limitations on transportation, PHAP members continue to work in the background to ensure that medicines reach Filipino patients, as Dr. Temesis mentioned earlier. We are overcoming challenges and to operate in this new environment. Salamat po for giving us the opportunity to be in this show.
Okay, thank you very much. It's our pleasure. Ted, from your end, what do you have to say about the current situation? Hello, Ted?
Hello. Yes,
Yes.
Melo. Sorry, I just wanted to check lang kung ano na kasi I also lost some of the audio feed ni kay Janet, no. But magandang hapon po sa inyo, Melo, and to all your listeners. Thank you for inviting PHAP, no, and PHAPCares Foundation to be part of this, no. So as you know, this pandemic continues to evolve every day. Urgent needs are arising and immediate actions are necessary, no. So the presence in the Philippines of our member companies, the pharmaceutical companies, involved in the research and development for COVID-19 offers a very good opportunity for timely dialogue, with government. Also shows how the private sector can actually work very well with government. This is one of the best examples. Unfortunately, of course, it's something that we would rather not have. But at the same time, it shows how the private sector can provide a lot of initiative and assistance to government. So there are positive steps we can take together now to ensure that new treatments and vaccines will be available and affordable. Beyond this pandemic, we are hoping that we can call on government to work closely again with us so that we can plan for and secure sustainable strategies for future public health emergencies. So our 39 members are on standby for any questions that may be addressed to other members who are not to other companies who are not our members. We just beg your kind understanding, no? And having said this, of course, Dr. Beaver Tamesis, Ms. Janet Hacosalem, and myself will do our best to respond.
Yeah,
thank you very
much. Thank you. Dr. Beaver or Ted or Janet, would you have any idea dun sa 100 milyong Pilipino, higit sa 100 million Filipinos, ilan ang bumibili ng gamot on a regular basis? Would you have any idea?
Well, most of our peers in the industry, mga innovator companies, we tend to hit about the upper 9% of the Philippine population. These are usually the patients na can afford, na out of pocket, na bumibili ng mga gamot, o di kaya na hospital at kino-cover ng PhilHealth. So approximately 9 million ang daily na to-touch namin na pasyente. Of course, there are different drugs, may have more patients than other drugs. Some are less, but no less important, lalong-lalo na what you mentioned earlier, that some patients are already running out or having difficulty sourcing their drugs at this point in time. So approximately, tingin ko about 9 to 10 million ang on a daily basis are touched by our drugs.
Opo. Sa ngayon po ba may mga sapat na gamot sa mga drugstore? Sapagkat ang feedback ng aking mga kaibigan sa Facebook, siguro makikita nyo rin naman, mula sa San Jose del Monte hanggang doon sa Mindanao. Ang problema, mahaba na yung pila sa drugstore kahit mainit ang araw. Pagdating doon sa loob, wala naman yung kailangang gamot. Ano po ang nakikitang solusyon dito?
Well, I think we need to divide this into two categories, right? There's those chronic prescription drugs, lalong-lalo na say for diabetes, hypertension, and then there are the over-the-counter drugs like the vitamins, lalong-lalo na vitamin C. Ang nangyari ever since the announcement of the quarantine, community quarantine, ang nangyari, people started buying more than their usual. Normally, we see people buy about 1 month's worth of product. They can keep that at home and then just buy and they just renew. We suddenly saw a doubling of the purchases by patients. Dumoble talaga. Watson's was ordering more than their usual, almost 2 times their usual orders. Kaya tuloy, we had a run on many of the products, pati yung mga vitamin C. I mean, like every time you go to Watson's, panay stock out sila, wala silang available product. So that's the main issue. First issue is that everybody panic bought at the same time. Sabay-sabay kaya nagkaubutan.
Yeah.
Hopefully, as we try to increase or bring in our importations, we'll try to stabilize the supply chain and yung pagdala sa Mercury, pagdala sa mga branches ng mga drugstores. Ang problema naman ngayon is when the drugs arrive in the Philippines, iilan na lang ang ports. And kung palilipad naman natin, wala nang flights. Pahirapan to get flights to bring the product into the Philippines. And many pharma companies like myself, were paying almost 50% more in terms of cargo space to be able to bring product into the country. Yan ang nangyari. Those are some of the unintended consequences of closing down airports or reduced flight reductions. Wala tuloy ngayong mga eroplano. So kung sa barko naman, well, we know about the port congestion that's happening now. I'm glad to see in today's news feed that the government is working to reduce the congestion that's happening sa mga ports natin. But in the meantime, naghahanap talaga kami ng ibang mga ports na pwedeng dala ng mga produkto namin para ma-offload namin sa barko. So these are some of the issues that we're facing now.
Seryosong
And if I may just add,
seryoso to, yes.
Lalo, if I may just add
Please.
on the local supply chain, kasi when the ECQ was announced, everybody actually was really unprepared of what would happen on day one. No? So there were a lot of lockdowns, checkpoints were set up. On the people that's in charge of the local logistics naman, the challenges that we were facing were our trucks could not get through the checkpoint because in the initial announcement, it said that only food cargo was allowed. Eventually, the government modified the regulations and included medicines and medicine supplies. And that helped to ease now our ability to transport goods by land. But the current challenge that we still face and started from the time that the ECs from Metro Dr. Divs, so imported, they get to Metro Manila. We warehouse those mostly here in Metro Manila. Then we need to ship them out now to Visayas and Mindanao. Under normal circumstances, when we're shipping drugs, we do it via commercial flights. So when they put on hold all the air travel for passengers, so did the flights that would normally take the medicines to Visayas and Mindanao. And that's the challenge that we started to face. So when you put that together, the stockpiling that patients were immediately doing, plus the challenges on bringing medicines from Metro Manila to Visayas and Mindanao, that's where you start seeing the shortages.
Okay. From a consumer's point of view, Dr. Beaver, Ted, and Janet, wouldn't all this result into higher costs of medicines, which the people may no longer be able to buy or to afford?
Well, as much as possible, we will not raise our prices, right? And of course, these are essential products, so the government has every right to mandate some price controls, particularly at this time for essential drugs. We'll try to manage our costs, but definitely this situation cannot go on for a very long time. Something's got to give. So I'm glad that the IATF is listening. They're responsive to our concerns. So that way we can try to help reduce some of the costs and make the products move faster. Sometimes so the problem can be at a very local barangay. Fine, pinapapasok na yung truck with the driver and the medicine. Pero paano naman yung helper na magbababa ng gamot, ng mga karton sa loob? Yung mga yan, pinagbabawal. So it's very different interpretations as you move from barangay to barangay to barangay. It would be really helpful sana if the IATF can be much more, I guess, directive sa mga to na, hey, these are essential products. Everybody needs this. Okay, so iba-ibang interpretations kasi, yan ang problema nga natin ngayon. But we're doing everything we can to reduce our costs so that we don't have to pass on these costs eventually to the patients.
Yeah. The reason I asked Dr. Beaver is I just got feedback from Polangi Albay na meron nga silang drugstore, wala namang empleyado dahil ayaw palusutin sa checkpoint. So hindi mo naman naaasahan yung may butika na siya magbebenta ng gamot. Ano po kaya?
Well, again, this is an issue of local implementation. This is local implementation issue na dapat sana the IATF gets that feedback so that they can actually address it very quickly. And I think the experience of Metro and Zwilik has been precisely that the IATF has been very responsive so long as the issue is raised directly with them.
Yeah.
Okay.
We've been raising this issue with the TWG, the Technical Working Group that DOH formed. And as Doc Beaver said, they're actually listening. You know, they're very responsive. They've issued the IATF ID. Supposedly, drugstore owners, because they're part of essential services, should be able to apply for that IATF ID on the website, and then they can issue the ID to their employees. Para dapat the checkpoints should allow the employees to pass through by showing the IATF ID.
Yeah. I remember during the first days of the enhanced community quarantine, I raised the concern, paano naman yung mga nasa punerarya? Kung hindi mo padadaanin sa checkpoint yan, paano ng mga yumao? Mabuti naman, lumuwag na, kasama na yung mga embalsamador sa pwede nang lumabas ng bahay. Hindi naman sila pwede mag-work from home eh. Right? So anyway,
Right.
nabanggit po kasi ng mga netizen natin, mga kaibigan natin sa Facebook, na merong shortage ng multivitamins at over-the-counter disinfectants kahit na yung rubbing alcohol. How do you look at this?
The shortage, Melo, as Doc Beaver said, is really artificial because it's coming from people stockpiling. They go and buy more than what they need. We're on the supply chain, we're trying our best to be able to catch up on the increase in demand. That's why our appeal to the public really is, huwag nang mag-stockpile. There's enough supply for everyone, and you buy only what you need. Because by buying more than what you need, you actually deprive those that potentially could need more the medicines more than you do.
Ay, good. Mabuti po kung gano'n. At least, kami naman kasi, well, I wouldn't know. I can speak for myself. Wala akong panic buying. Hanggang panic lang ako. Kaya that's okay. Hindi ako nakadagdag doon sa problema ng mas marami. Ted, ano ba experience niyo pag may mga pagkukulang sa ganitong mga gamot at iba pa? Coming from your end.
Yeah, well, actually, because as Doc Beaver and Jeanette have already explained, our members are also very much in tune, with what is happening. As you know, there are several medicines that are being used, for example, dito sa treatment ng COVID, which are what they call off-label, yung di talagang ginawa just to treat COVID, but they were used for lupus and other ailments, And suddenly, because of anecdotal evidence coming from other parts of the world, and also some practitioners here have also begun using it, bigla na lang there's been a run on several of these medicines, and as a result, there have been some shortages. But thankfully, yung members naman namin, those who are involved with producing these products, have managed to actually source more supplies coming from other countries. But again, the appeal is particularly for those who have, let's say, mga autoimmune disorders, who are using a particular drug. The appeal really is to not to use anything in terms of yung parang prophylactic use lang. In other words, yung nagbabasakali lang that they should use it and therefore have to get a prescription from a doctor who may who of course will exceed. Pero just make sure that you always work with your doctors and make sure that you help our companies ensure the supply, for these products. Our members have been working very, 24 hours, non-stop, several days in the week, to source items coming from Australia, from Hong Kong, from Vietnam, and thankfully even flights coming, yung mga PAL flights, that are operating on a limited capacity are now stocking their passenger cabins, and cargo bays with these medicines. So we're actually very appreciative of that concerted effort working with the air transport industry. But just as an appeal, please don't hoard, don't stockpile. I mean,
Okay. And even more important, siguro, fine, nag-stockpile kayo, but please don't take it, right? Unless supervised by a doctor. These drugs, Oh, these drugs that are being used for these conditions of lupus na mukhang pwede rin daw gamitin sa COVID, they have major side effects and potentially life-threatening side effects. Kaya dapat talaga under close supervision by a physician.
Yeah.
Lalong-lalo na yung hydroxychloroquine na yan can cause sudden death or even
Really?
blindness. Can
Wow.
cause sudden blindness. As little as 1 dose pa lang, pwede na magkaroon ng blindness.
Oh, okay.
So it is not, these are not necessarily very safe drugs. They have to be used under the close supervision of a doctor. So please, please do not go out there and just buy it and start taking it just because you think nababalitaan nyo that's helpful daw.
Binanggit ni
It's not even
President
proven.
Donald Trump eh.
Ay, isa pa rin yan saksakan ng
Easy. We're joined by Dr. Evan Vista, a rheumatologist and a board member of the Philippine Rheumatology Association. Dr. Vista, good afternoon. Welcome to our COVID-19 focus.
Hi, good afternoon, Sir Melo. Good afternoon to everyone. Thank you for the invitation.
Yeah. Anong experience ng Philippine Rheumatology Association doon sa nagkukulang ninyong gamot para sa mga lupus patients?
That's why from the start of the pandemic, PRA has been coordinating with the brand manufacturers of hydroxychloroquine. So the current prevailing status is the inventory for hydroxychloroquine is only for the patients with lupus and rheumatoid arthritis. So if we go by the prevalence, ang inventory stockpile nila, depende dun sa pharma, will be konti lang kasi hindi naman ganun karami ang lupus and rheumatoid arthritis compared to hypertension, compared to asthma. So ang nangyayari, yung stocks talaga, ang prevailing stocks ngayon ubos na. And we just have to highlight na dalawa yung anti-malarial. It's chloroquine and hydroxychloroquine. For the longest time, hydroxychloroquine is no longer considered as anti-malarial. It's mainly used for lupus. Initially developed siya as anti-malarial, but if we choose between the two, yung chloroquine talaga yung naka-stockpile sa government for malaria use. So, dahil doon sa mga maliliit na studies na lumalabas ngayon at katulad ng dinagdag pa ni President Trump, globally, talagang ang lakas ng demand ng hydroxychloroquine at na-compromise yung supply ng lupus, lalo na dito sa Pilipinas. Kasi nga yung inventory is dependent lang on the prevalence that hindi naman kasing dami ng common diseases like hypertension. So what we want to call upon kami sa PRA is if this will be the wala pa tayong standard approved therapy, no? Pero most of the hospitals are using this now kasi kasama siya sa PSMID algorithm. So if we can use the stockpile of the government for chloroquine bago maubos yung hydroxychloroquine while we await for further replenishment of our hydroxychloroquine, kasi we just have to really categorize that hydroxychloroquine is more of a lupus drug than an anti-malarial.
Okay. Thank you for the input. We'd like to acknowledge we're joined by Paulo Barcelon of CNN and Apple Salandoni of ABS-CBN. Dr. Bieber, yung problema po ng mga rheumatology, meron kayang paraan ang PHAP to look into the supply in the Philippines of this wonder drug mentioned by President Trump?
I wouldn't characterize it yet as a wonder drug, though we are all hoping that it actually does contribute quite a bit, right? All we can do right now, syempre, we've tried to put the right people in touch with the right people, the manufacturer, with the hospitals that are in need, try to direct them to where the product actually is. We're even talking with our friends in Mercury to make sure that we know where exactly product is. So we try to direct patients or those in need to where they can actually try to get the product. And if and when our member company has difficulties or issues with the importation, we do try to exert try to make some certain phone calls just to make sure that people are aware, the right people are aware that the product is actually waiting for clearance to just enter the country para lang ma-distribute kaagad. And that's something that I think the power of the industry association, our ability to find the right person to call just to assist in these trying times is actually quite satisfying, quite gratifying meron kaming may tumutulong talaga sa amin to be able to bring these life-saving medicines into the country as soon as possible.
Yeah. Let me ask you, I hope you will just say how it is. May problema ba kayo sa customs?
I think Janet can answer that question.
Janet?
Yeah. The perspective that we have in Metro Drug specifically is we don't do the direct manufacture, Ted, because it's mostly the suppliers of the medicines like those coming from from overseas that actually do the importation. But well, as Doc Weaver mentioned, when we shout, they actually do listen, no? And we see immediate action. That's, I think, one advantage that we have in PHAP because we already have connection within DOH and FDA that can help us push the right buttons that are needed to get the medicines into the country as soon as possible.
Yeah,
But maybe as a direct answer to the question, we are seeing problems in customs, essentially in the ports. It's not to zero down on customs, but it's in the ports where we're seeing some backlog.
How serious is it?
There's a big backlog, Melo. I mean, and I think what happened nga, as I mentioned that Janet could answer that question because we experienced it firsthand, when we were bringing in some medicines over the weekend, so we needed to reach out to our contacts in the Department of Finance, the Bureau of Customs. I mean, just to make sure that it could move and be released immediately, because there were so many patients who were seeking these medicines, and our members were getting the doctors were getting the doctors and the patients themselves were very frantic about it. Thankfully, with all the support we got, we were able to do that. And that's just an example of the cooperation that we have been seeing between our industry and that of government.
Okay. We have several questions from a colleague, si Paulo Barcelon. Paulo, of CNN.
Alright, magandang hapon po sa inyong lahat. Unang-una, na-mention po itong questions about problems in the ports. Can we just go into detail more about these problems in the ports and what solutions is the government offering to help na ma-expedite yung pag-release po nitong mga gamot? Because kung may congestion po sa ports, that means you were mentioning, it contributes to the problems in our supply chain. So what specific problems are you encountering in terms of the ports po?
Well, at one point, sometime this past 10 days, nagsara ang North Container Port because there was a positive patient who was determined. They identified an employee who was positive daw. So syempre, they have to clean up the port, right? They don't want to infect other people. So sinara yan, so that aggravated the problems. Now you have to shift everything to the South Port. Pag i-offload mo naman, the container ports are packed with container vans that hindi na nailabas ng owners simply because nag-shut down na, nag-ECQ na. So tuloy, we are having to look for other alternative ports where we can offload our product. And one of them that we're looking at is hopefully the Batangas port. That's the closest one to Metro Manila. So for now, mukhang nagawan na ng paraan. But yeah, these are some of the issues that we're faced with. And I just saw this morning that in the news that the government is now going to mandate that all of these, or at least a significant portion of the containers support, may labas na. How exactly they'll do it, it's unclear to me, but at least the government has taken cognizance that this is a problem and they're actually going to start working on it.
In terms naman po dun sa mga gamot na nasa ports, what kinds of medicines are we talking about? Are these just the over the counter or ano po yung...
Well, every single importation, but I can tell you, like yung sa company that I run, it's a lot of the anti-diabetes drugs, anti-diabetes, hypertension, cholesterol products that people need. while despite all of these issues of COVID, dapat tuloy pa rin gamutan. Lalong diabetics are at high risk for potential complications. So all the more they need their drugs. So these are some of the issues na we're working through para hopefully hindi lang just in time masyado yung pagdating. Because we all know that just in time doesn't necessarily work here in the Philippines. Too many things can happen pa rin, di ba?
Understood.
Yes.
Follow-up lang po.
Sige.
In terms of tawag dito, yung number of patients and then yung sa stockpiling. Yung stockpiling po ba, ang involved dito usually are, what kinds of drugs are these? Pain medications, vitamins, ganun po. You based on what your experience po.
Based on what we're seeing, a lot of it was really the chronic drugs, chronic care drugs like hypertension, diabetes. Now we saw a huge run on these. Of course, vitamin C. Pumipila din ako to buy my own medicines, right, sa butika. That's why I hear people asking for vitamin C. Grabe, ibang klase. So you know that people are buying this product like crazy. That's all you hear people talking about. And then of course, yung alcohol, naubusan ng alcohol. During the first wave of panic, naubos, tapos nagkaroon uli for about 2 weeks ng supply, then ngayon biglang nawala. So I don't know if alcohol has come back to the drugstores, but I do see alcohol being sold online sa mga Viber groups namin. So there must be alcohol somewhere, but it's not reaching the supermarkets.
Yeah. Malaking problema yun.
Siguro, final question for now on my end. I don't know if you're the right person also to answer. What about equipment, like medical equipment, face masks, yung mga ganin po? Are you also encountering supply issues with that? I don't know if you're the right person to ask that, pero just to ask, check this.
Yeah.
If
I may. No, if I may. Yes, that's also Paolo, frontliners with more face masks and PPEs, no? And what we are seeing is that there is a big problem because it's not only the suppliers, no, it's also the donors, no, those who want to actually give are seeking supplies, no, sources for donations. And our Janet is not on the line at the moment, but our CSR in fact has been working with another groups to source these products so that we can give them. And Janet. So we're trying very hard to seek to get more supplies, but what we're seeing is that there is a constraint. I think some of those importations are also probably because of the bottleneck in customs, you know, whether it's in the port or in the airport. No? So, but rest assured that this is actually being addressed and should be moving. There should be more availability of these supplies soon, you know.
And if I may just add, this is one area that PHAPCares is actually already focusing on. No? We got supply for about ₱1 million worth of PPEs. And my realization out of all this, because I'm not a medical practitioner myself, I'm actually really on the commercial side. My realization is, for example, if we donate this 1 million worth of PPEs to San Lazaro Hospital, this is only equivalent to 3 days of the requirement. Because, you know, you cannot reuse. You have to dispose as soon as within 4 hours that it's used, it has to be disposed of. And that's, I think, one of the reasons why there's that seen shortage in PPE supply. The other contributing factor is we are importing most of the PPEs that we're utilizing locally. And because this is a global pandemic, each country is already holding on to their supply and are not allowed to be exporting. As of now, what we're seeing, it's really only China that's exporting PPEs because I guess patapos na sila sa kanilang COVID. But everybody is also trying to get the supply from China themselves. I think one area that the government can really help out is the local manufacturers of these PPEs. They should not be allowed to export anymore and should prioritize local requirement. If it's not yet done, I hope that they do that already.
All right. Thank you so much po.
Yeah, okay. Apples? Yes, Apple Sarandon of ABS, would you have questions? Hello? Okay. Wala pa siguro. Pero kasama rin natin si Marlene Robles. Marlene, may concern ka? Yes, Marlene?
Yes, Melo, can you hear me?
Yes, of course. Go ahead.
Mhm. I'd like to know if provisions have been made to make available a hydroxychloroquine.
Okay.
I'm a lupus patient. I need the drug, and I don't have any.
Okay. Let's hear from our friends from PHAP. If there's a way we could find a medicine for you. Dr. Beaver, please.
I think that you may have more information on this, Ted.
Yes, Marilyn, yeah, thank you for your concern, your question. No? We are working very closely kasi, with our members who produce the product. You know? And you are correct. You know?
Yes, Ted?
Ted, na-drop ka yata.
Ted?
Well, what Ted was trying to say is that we are
Because
working very
we have actually worked very closely. Yeah, we're working very closely with of course the distributors, the Israeli group, as well as the company that makes the product, you know, Sanofi in this case, and also with the outlets like Mercury. You know, what's very helpful here is that when you have the prescription, you can actually now send it electronically, no, or even through Viber or from WhatsApp, or these other groups, and then this can then be sent to the branch in question, and they can actually attend to it. But again, this is a very unusual situation we're in. No? So the branches themselves, I'm told, of these drugstores are being given limited stocks. You know, they're rationing them as soon as they come in, these get dispensed right away. You know, so thankfully the companies are actually ordering more supplies, and the FDA has actually even allowed them to be, you know, well, the restrictions have actually been lifted somewhat. You know? So what's important here is that you have to help us also by giving us the information so that we can raise these concerns to the proper authorities, no?
Mm-hmm.
And also the proper channels.
Isang problema kasi kung maintenance drug yun, pagkatapos unavailable, yun isang problema.
Opo, yeah, we experienced that na nga, no, with recently the spouse of one of our contacts, you know, ran out, no, so we really had to work also to assist them look for the supply, you know, and eventually we did find a supply, you know, because again, what's happening is that people are coming in and buying it as a means of protection, no, I mean, they think that it's there to protect them from. If it's not for COVID, it's to protect them from COVID, no? Which is really not the case, no? So we also ask our friends in the medical profession are also, you know, being asked by people that they know to prescribe it.
One place you may want to try, aside from the drugstores, might be some of the hospital pharmacies. I don't know if the hospitals would be willing to sell it, but I know that hospitals have been buying a product so that magamit nila for their COVID-19 patients, the actual confined patients. So you may want to try chatting with some of the major hospitals, because I think their pharmacies have stocked up or loaded up on the product.
Yeah.
And the prioritization of in terms of issuing
hydroxychloroquine.
Okay.
Yes.
Is really number one to the patients that actually have been prescribed this medicine. So
Yeah.
those that's on maintenance, their priority. I think the drugstore branches of Mercury, for example, have been instructed that unless the patient presents a prescription, they're not supposed to be selling this to anybody, because it is not correct to use this as a prophylactic. The second priority is the hospitals. Again, to treat the potential COVID patient.
Marlene? Okay.
Yes, may I just make a comment? I find it strange that hospitals are using hydroxychloroquine to treat COVID-19 patients. This is supposed to be under clinical trial.
Well, Marilyn, all I can say is that when a patient is near death, you will try anything. And it is in the treatment algorithms, the local society with blessings of all the research and the best minds that they put together have inserted an area where, yes, they will use the drug. So it is within their treatment patterns on how they will try to manage these patients who are under extreme life-threatening conditions already. Make
I-
no mistake, COVID-19 is acutely life-threatening.
Yeah. Okay.
I get it. I get it. I understand that hydroxychloroquine is being used as compassionate care drug, and it's just that, well, I reserve my comment.
Okay.
Thank you very much.
Thank
Thank
you,
you very
Marlene.
much for attending to my question.
Salamat. Si Marlene Robles po, ang Pangulo ng Lupus
Thank-
Foundation. Nakasama ko na rin siya sa tapatan sa Aristocrat. May isang problema nakarating sa akin. May isang pasyente na taga Pulangi, Albay. Yung kanyang doktor nasa UST. Ang problema, may lockdown, walang biyahe, walang eroplano. Kailangan na rin ng prescriptions at yung kanyang ilang mga gamot, prescription drugs sapagkat meron siyang dementia or something, may Alzheimer. So, kailangan ito. What would be your suggestion?
Melo, as mentioned now, no, there's a lot of flexibility with respect to prescriptions being honored at the drugstores. No, you can actually get your doctor to issue a prescription, take a photo, send it via Viber or to the patient, and that patient can go to the drugstore and show it. That was actually what they call the e-prescription form. I think that is being used. FDA approved it at the start of this pandemic. One of the first circulars to come out was about acceptance of e-prescriptions at the drugstores, and at the hospitals.
Okay, so pwede na pala. All right. Very good. Mabuti kung ganon. Apples from your end? Apple Salandon of ABS-CBN. One more time.
Hello, good afternoon.
Go ahead.
Good afternoon.
Yes, Apples.
Good afternoon, sirs. Yes.
Go
Okay,
ahead.
thank you so much po. Meron pong mga reports na siguro para sa ating mga expert po. May mga reports na there is this tuberculosis vaccine that has been used for many, many years that can probably boost the body's immune system against COVID-19. Meron na po ba tayong impormasyon tungkol dito at gaano po katotoo ito, sir? Salamat po. Thank you.
Yeah, we're seeing these scientific reports talking about, now note this is purely observational data pa lang. Observation means they just took a look and then trying to now make a connection. There's no clear direct link yet, they're just associating it pa lang. But the report says that in countries where BCG program, yung ginano dito sa balat natin, sa deltoid, as a child, countries that have this BCG program seem to fare better, meaning less ang mortality rates when it comes to the COVID-19. Philippines has had that. The BCG has been going on ever since time immemorial dito sa atin. So BCG is used to try to prevent tuberculosis, as you all know. So,
Graduate ako ng
yun,
BCG.
say that again?
Graduate ako ng BCG. Na-reveal ko.
Yeah. Lahat tayo, meron nun. So, because of that, that's the associated type of a study. It's observational pa lang. And yes, BCG does improve or increase your immune response to try to prevent nga yung tuberculosis. Whether or not that translates to actual efficacy versus COVID-19, we don't know. This is just an observation. The vaccine is still available, but it's now used primarily to treat bladder cancer. Aside from the vaccination programs, it's also used for bladder cancer. So even that, parang people are suggesting, pero yun ang problema at this early stage of the pandemic. It's so new, this disease is so new, people are just trying anything and everything. They're looking for clues everywhere. But again, it is not definitive proof. Okay? So Philippines has been part of it. I'm pretty sure everybody in this room, in this chat room, has had BCG. I'm pretty sure of that. So yes, we've actually received hopefully we're getting the benefit of that vaccination program.
Okay. Apples, follow up?
So, thank you for that, sir. Follow-up lang siguro po, may mga reports din po na sinasabi na yung virus, COVID-19, ay can be transmitted hindi lang po sa droplets, kundi pati sa normal speaking and breathing can be transmitted to another person. How accurate is this, sirs? At saka, so kailangan ba natin mag-face mask na talaga pag lumabas tayo ng bahay? Thank you po. Salamat po.
Well, I think, thank you for the question. I think there has not been any dramatic shift in the mechanism of transmission. It's still droplet pa rin yan. And droplets can occur also in conversations. We all see sometimes may tumatalsik na laway. Ganun na yan. That's part of it, right? So it's still droplet transmission. Now, of course, in close conversations, like if we were right each like that, for sure magkaka-transmission, right? So it's important to maintain that actual physical distance pa rin of at least 3 feet or 1 meter, ideally 2 meters ang pagitan natin. Now, of course, if you're in a crowded room or if you're going to the supermarket, I would personally much rather wear a face mask there. But if I'm in the middle of the street, like the next person is 1 kilometer away, which is nangyayari na ngayon sa enhanced community quarantine, I don't see the point in wearing a face mask in that scenario. But I guess in an effort to be much, much more aggressive in trying to ensure everybody protects each other, yun na nga, the IATF is strongly recommending, if not actually ordering all of us to wear face masks when we go out. So it's still droplet. Droplet is still the main mode of transmission. But I suspect that because we're trying to break any further transmission through this physical distancing period, nire-recommend na talaga gumamit ng face mask.
Okay. Apples?
Thank you, sir. Yun lang po. Salamat po.
Okay, let me ask our guests, our panelists, because you come from Pharmaceutical and Healthcare Association. No? Healthcare. What do you have to say about PPEs? What do you have to say about face masks, which are all in short supply these days?
Well, I'm really appreciative of all of the efforts that the various groups have been doing to create homemade or locally made PPEs. They're even very careful about the kind of material they use when I read the details of what they're doing. So I'm really very appreciative of everything they're doing to be able to help the people in the hospitals, in the emergency rooms, in the wards. Definitely, nobody was ready for this. Let's be honest. Nobody anticipated the severity of this pandemic and how widespread and how contagious this particular virus is. Kaya tuloy, this is a major learning for all of us. Hopefully, after we get past this, gawa natin ng magandang polisiya. Stockpiling might be a necessary thing that we must all engage in to prepare for the next pandemic. Because this will not be the first, this will not be the end of pandemics. This is just the start of all pandemics.
Really? If we were to look forward, do you think the supply chain has severely been affected by COVID-19? And what are we to do to assure everyone that your medicines from Wuhan would reach Manila, your medicines from Europe will get to Manila and get to the provinces at the soonest possible time?
Yeah, I think if I may answer that question, Melo, no, that's actually one of the areas that maybe our government failed to consider and look at closely when they thought of implementing the enhanced community quarantine. It's understandable that what you immediately do is to stop travel. But in the Philippines, our situation is most of we're an island country. We're composed of 7,000 something islands, and not one island is self-sufficient. So for Metro Manila, for example, where we have most of our medicines, we get food from other islands. And in the same manner, the islands don't have source of medicines. Most of it would come from Metro Manila. That is something that government should look at for maybe another pandemic, making sure that when there's travel bans, they do not forget that supplies, food, and especially medicines still need to be transported. That's one area that actually really was forgotten when they implemented the ECQ. This current ECQ that we're executing.
Well, of course.
It's a good thing. Yeah.
Sabi nga, it's never too late for us to learn from our mistakes, right?
Yes, yes. And I think it's also looking at the partnership with private, no? Because there are a lot of expertise that's available in the private sectors that the government can tap on. And the experience that we're seeing now is they're really listening to the private sector and taking into consideration our recommendations when they craft this circulars.
Yes, if I may add, Melo,
yes, please.
to what Janet said, no, this is really an experience, no, and I don't want to sound pessimistic because they say that this is not going to be the last pandemic, you know? But there could be other similar situations that may arise. But at least let us be prepared, no, for any kind of emergency like this one. And thankfully, we hope that not just this government, but in succeeding governments, that they will not hesitate to work with the private sector, because this is what we're seeing now. They're appreciating the skills, the knowledge, the know-how that the private sector brings, particularly in transporting and in logistics, no. And what we ask government to help us with is really to ensure that the laws and regulations are actually adjusted so that the transport and distribution of these essential medicines is unhampered, no. And I think this is what we're seeing. They're listening, and they're responding positively.
Yeah. Dr. Beaver, about a week ago, I asked Secretary Anyo in one of the briefings how DILG looks at our jails, especially those under the Bureau of Jail Management and Penology, na masasabi natin mas puno kaysa sa ibang mga piitan sa daigdig. Don't you think this is a ticking time bomb dahilan sa maapektuhan ng kalusugan ng mga napipiit dahilan sa hindi pwede yung social distancing sa loob ng city jails?
Yeah, that's definitely a ticking time bomb. As very, very congested sila. Pero we don't even have to go to the jails, right? Tingnan lang natin yung condition sa Payatas, mga condition sa Baseco. I mean, like San Andres, Bukid. Patong-patong talaga mga bahay and mga tao doon. They're literally sleeping on top of each other. So it's very, very difficult in this particular scenario to really enforcing social distancing. Kaya we have to really do more than just physical distancing. I think it's important na hanapan natin lahat ng mga kaso. Let's find all these cases. If we can bring in the right drugs to actually treat the disease early, habang hindi malala, para hindi na umabot ng hospital, all the better. We have to be much broader and much more concerted in our efforts rather than just relying on physical distancing. Importante physical distancing, yes, but in situations where it's impossible to do it, we have to have a much broader, much stronger, robust strategy. And I think that's what the government is starting to signal they're actually thinking of doing. You see, sabi nila, mass testing come next weekend. So tingnan natin how this plays out. And that may be potentially very, very helpful, because I don't know if you've noticed, but PGH, the Philippine General Hospital, has been calling for volunteers, mga people who have recovered from COVID-19, to donate blood, because they're looking now for the convalescent antibody that the patient who recovered from COVID-19 actually already has. And they're thinking they can use that serum and inoculate or treat the patients who are suffering from COVID who are confined. And that will give you at least this window of opportunity to be able to help these patients, lalo na if you can find the patients quickly enough. So yung mga testing, mga lalo na nag-antibody positive na dyan, you can find these antibody positive patients and magaling na sila, potentially they could be asked to donate blood so that they can help other patients who are in need right now.
Aha. Okay. Pero hindi po kaya dito sa COVID-19 na ito, lalong tumingkad yung agwat ng mayaman sa mahirap? Dahilan sa, katulad nun, hindi ka nga napupunta sa city jail, pero nakatira ka naman sa payatas na talamak ang kahirapan. Ano po ang inyong pananaw dito?
Again, it's a factor of the way our society is so divided. The economic divide is so huge, right? But yeah, I mean, like, hindi lang yung mahihirap ang nagsasuffer. I mean, like, we hear about people who live in Forbes Park who die from this disease, right?
Yeah.
Who live in Forbes or in these very expensive condominiums na namamatay din. So at the end of the day, tao na rin lahat tayo. So we all need to help each other.
Yeah.
And that's what's unique about this virus, Melo, eh. Kasi walang kinikilalang mayaman or mahirap, popular ka ba or normal na citizen. It actually doesn't respect borders as well. But if you, for example, look at other countries like South Korea, they're actually looking now at South Korea because it seems that COVID there is very well managed. And one of the factors that they're able to manage COVID is the testing. They've set up a system where you can actually do a drive-through testing for the virus. I think this is one area that our government should look at so that as soon as somebody shows symptoms, you can immediately do the test. And these are the people na pwede mong i-quarantine. Kasi I don't think that it is sustainable for a country like ours to go for a longer quarantine period. We have to look at the economics. We have a lot of people that are dependent on daily wage. You've stopped that now with the quarantine. These people are already getting hungry. Paano yung mga pamilya nila? So there's a lot of things that government is now starting to look at. They're starting to bring in the test kits. But I think another area that needs to be considered is also the laboratories that are capable of coming out with results of these test kits.
Yeah. Kahapon nga, natanong ko kay Senator Dick Gordon dun sa pagharap niya sa Foreign Correspondents Association of the Philippines, yung tungkol sa posibleng realignment from infrastructure to the health sector. Sapagkat ang isang problema, kung may sakit naman yung mga mamamayan, wala rin gagawa ng mga tulay, walang gagawa ng mga overpass, walang maghuhukay ng lupa para sa mga subway natin. Eh sabi niya, pwede naman daw ma-realign. Pero it may take some time because parang we've long forgotten our health sector. I don't know whether Ted or Dr. Beaver or Janet will be able to answer this. What is it in Cuba, a developing country, that they get to send doctors abroad to help people in crisis? Yes, please. Anybody of you? Dr. Beaver? Yes, Ted?
No, about Cuba, I really don't know how to react to that question. I mean, I know that they have been exporting their medical professionals to other countries, no, which have been hit. I think there are some that have gone to Italy and other places. No?
They were in Haiti.
In Haiti, well, of course, it's their neighborhood. It's in their backyard, yung Haiti. So, I don't know. We really can't say what it is, because it seems that they're also doing this as a means of goodwill, for that matter. We don't know if they have actually. We don't know what cases that they have over there. Maybe they have it under a degree of control, for that matter. But it's hard to comment. No?
Yeah, Dr. Beaver, got anything to say? Oh, okay. Janet?
Baka naka-mute siya. Oo.
Anyway,
Sorry. Yeah, nakamute nga.
okay.
I think we were blindsided by this. I mean, like, we didn't appreciate the severity, I think, of the illness at the very start. Tutuloy, a lot of the medical professionals got hit hard very early, very quickly by this particular virus when it started hitting the hospitals. Only after the first few days, that's when we realized how severe it was, when suddenly mandated na lahat mag-PPE. And with that, yun, tuloy, there was already a lot of people who got exposed, so na-quarantine kaagad sila. We had 1/3 of the hospital medical nursing staff who were on quarantine. You cannot function with just 2/3 of your staff. And then you now have to physically separate the COVID suspect patients versus the regular patients like mga broken bones or heart attack patients. Siyempre, tuloy pa rin yan, mga emergencies pa rin yan. So I think we were a bit blindsided
Yes.
by this, and nobody. I think the lack of testing, I think early on, prevented us from identifying the patients quickly enough. That yung pala he's actually a COVID patient that isolated kagad. So yun, there was a lot of that, and then I think it's only after the first week or two that people's really got their acts together, so that I think there's much more efficiency in terms of the way people are handled at the emergency room level. But it caught everybody by surprise. I have to say that the severity of this illness, the contagiousness, and the way it was able to quickly penetrate the medical profession, the nurses, everybody in the hospital who would be exposed. So when you lose 1/3 of your staff because they have to go on quarantine, pahirapan talaga yan.
Anong tingin nyo doon sa mga bagong graduate na ma-expose sa trabaho kaagad?
Well, sabak, but I think they should be more in the support at the background. They shouldn't be doing direct patient care unless properly supervised.
Yeah, okay. Paulo, Apples, would you still have questions? Please go ahead. Apples?
Okay. Sir, siguro ano lang po, just to clarify lang po. So, sila ni Doc po, they're recommending the public to wear face masks paglabas sa bahay. That's the stand of our medical professionals ngayon, sir. So I just want to clarify that po. Thank you.
I think that's really more the order of the IATF. From the medical perspective, the face mask really helps prevent the person who's carrying the virus from transmitting. That's the main purpose. That's actually, if you look at all of the studies looking at what the value of the mask is, it's really to prevent spread from the carrying person outside, externally. The value of preventing somebody from inhaling it is open, and nobody's really studied that particular aspect, but the main value is preventing transmission. So if you are asymptomatic carrier, the likelihood of you transmitting the virus is much lower with the face mask. Okay, I think that's the main value. But the recommendations from what I'm seeing, when I follow the news also, is that the IATF seems to be recommending it day in, day out, paglabas ng bahay, nakasutan ng face mask. Now, personally, I think it's prudent that if you're going into the supermarkets, lalo na because, syempre, supermarkets, there are lots of people going in there to get their weekly supplies. So yeah, I would be cautious and actually put it on for whatever value it is. But the main value is to prevent the patient from transmitting it to the others immediately around them.
Okay, very well.
Thank you, Doc. Thank you. Salamat po.
Paulo, from your end? Okay, wala na. Sige.
Siguro one last question na lang
Please.
from my end. And this is for our experts. What do you believe should future steps do? Because we were talking about yung dapat na nakita yung transportation of medicines from various places in the Philippines. What lessons did pharmaceutical experts learn from this whole pandemic that's still ongoing, and what lessons from the past could have been applied to yung best practices na ginagawa natin ngayon. So, and then moving forward, how can we make sure that people could still get access to the drugs that they need, especially in times like these?
Well, from watching what's happening, obviously the hospitals, the facilities have to be ready with PPE for a pandemic level rather than for a normal daily basis, right? We have isolation wards in practically every hospital, right? Even in the emergency room, you can isolate the patient. But I think what this pandemic is teaching us, in an emergency situation like this, we need whole wings, not just one or two rooms. So we need to be flexible to be able to expand very quickly to these holding areas. We need PP geared towards pandemic all the time, not just yung pang daily type of cases who come in. I think that's one of the major learnings that I think every hospital administrator is probably picking up from here. From the pharmaceutical side, I can't really suggest stockpiling, right? I mean, like, these medicines expire. Masisira lang yan if we build up too much. But what I think we need to be very conscious of is how are the distribution channels throughout the country. Maswerte tayo sa Luzon na pwedeng through land. But when you try to get to the different islands, Palawan, Marinduque, Mindoro, it's not that easy kung walang aeroplano. How do we have enough boats that are going there? Is the RoRo actually working? Do we have enough routes for the RoRo? So this is something government needs to pay particular attention to. The inter-island highways, what's happening to that? Because I think that's what Janet was pointing out. Hirap na hirap talaga tayo to find ways to bring product to these different islands, these different airports. And we're paying a very pretty penny for chartered flights. Because yan ang nangyayari ngayon. We actually have to charter planes to bring drugs throughout these particular airports. So that's another area that I think, as a matter of policy, the government, Department of Transportation really needs to pay particular attention to the ease of transport across all of the islands and the different ways. Hindi lang dapat barko, hindi lang dapat aeroplano. How about bridges, if that's possible? All of these other things need to be thought of. I think that's and then also looking also at ventilators, the ventilator supply throughout the country, because ventilators are made abroad, unfortunately, and they cost like 1.2, 1.5 million pesos per unit. So do we have even enough of these ventilators throughout our public hospital system?
Okay. Mabuti po.
If I may,
yes, Janet.
If I may add, I think also the ability to test. If we're talking about pandemic and a virus, we need to have the capability to be able to test early on. Because if you have that capability, then you know immediately who you should isolate. Because that's what you want to immediately address. The person that's a potential carrier should not be allowed to go around and spread the virus. At the start of the pandemic, I think that was really one of the areas that we were very short on. And the government tried to correct that. But this is an area that I think for future pandemics, we should be preparing for already. And it's not only the availability of test kits, but it's also the availability of the laboratories that can test. We started with only RITM that had that capacity. What happens to a patient that's potentially in Mindanao? The swab test needs to be flown into RITM, that's in Metro Manila, before the actual laboratory test can happen. So it's having that capability across the islands, ability to test.
Yeah.
And remember when this first began, I mean, like, we were sending specimens to Australia.
Yes.
Yeah.
I recall. We sent specimens to Australia. Well, anyway.
Melo, if I may, to touch on the point, and those points for the future, yeah, with respect to the testing kits, we have to bear in mind also that just as the success that South Korea had, Because what's happened here is that, the gold standard is not actually, I think, always applicable, particularly when it comes to a wartime situation. No? So if you have a fire in the house, you don't question whether you use a fire hose or a fire extinguisher. You use both. Okay.
Yeah.
Now, in terms of the experiences also that we've learned here, the private sector and government can really work well, and that's where we're offering our help for future situations that might arise. No, pharmaceutical resilience is important. What we're also hoping for is that we can get a more favorable business environment. Because we ask that it make it more enticing for companies to be here. Because look, as we've seen in this crisis, there are 2 investigational drugs that were not locally available because the companies that own them are not present in this market. So that's also another thing to consider. No? So it takes time, and this is where every second counts. No? So let's try to mitigate any kind of crisis to make it government will be the one in charge and not limiting it to private sector purchases. No? That's exactly why the presence here of our companies in research and development continues to offer opportunity for timely dialogue, collaboration, and action to urgently bring in the needed medicines in the country. That's all we're asking. Thank you.
Yeah. Okay. We'd like to acknowledge na ka-monitor din si Linggoy Alcuas, yung ating madalas kasama sa Tapatan sa Aristocrat at maging sa Wednesday Roundtable at Lido. Wala yatang tanong si Linggoy. But anyway, let me ask you for your messages sa ating mga tagapakinig at maging manonood at mga kapatid sa media. Let's start with Janet. Janet, for your message, please.
Hello.
Janet, you're mute.
Yeah. I will speak first as the president of PHAPCares. As we mentioned earlier, we are the CSR arm of PHAP, and we're now really focusing our efforts around how to support our healthcare frontliners. We're putting together money to help provide for the PPEs, which today is really scarce. One advantage that we're seeing is pooled procurement. This is an area that really even the government can also look at after the pandemic, where we're seeing the advantage of putting together volume so that we can procure from China, for example. If we come in and make a request for even 1 million PPEs from China, they will not entertain us. But because our requirement now is already in the tens of millions, we're putting in one PO, they actually entertain our request. And we're actually able to also get it at cheaper price. So this is really an area where you see pooled procurement working. Not only, I think, for PPE, we should look at pooled procurement for medicines for our hospitals, for our DOH, for our government hospitals. The other area that I would like to take up, Melo, if you allow me, is really on supply chain. I am the chief executive of Metro Drug. Our business is in making sure that medicines get to drugstores and hospitals across the country. As I mentioned earlier at the start, this is one area that the government actually underestimated. The importance of supply chain, not only on the day-to-day requirements, but really in times of pandemic. Please do not forget there is supply chain that needs to be considered in policies. That's it for me, Melo. Thank you very much for having us.
Yeah, it's a pleasure to have you with us this afternoon. Dr. Beaver, please. Dr. Beaver.
Sorry.
Yeah,
I didn't hear that. Yeah, thank you all again very much for joining us today. I mean, it's been a pleasure and a privilege to be able to speak to everybody. Rest assured, PHAP will continue to do its best to make sure that we continue to innovate, find the cures, hopefully, or the vaccines in the future to prevent future pandemics. But in the crisis that we're facing, get at the soonest possible time. So that's our commitment, and we do take that very, very seriously. Thank you.
Okay, very well. Thank you very much for your time. Ladies and gentlemen, mga kapatid ko sa media at yung ating mga kaibigan sa Facebook at sa tunay na buhay pa rin. Bukas, Sa Tapatan sa Aristocrat, we will talk about the impact of COVID-19 on the seafarers, the maritime industry and the manning industry, sapagkat libo-libo na ang bumalik sa Pilipinas. We'd like to find out ano ba ang paghahanda ng gobyerno para sa kanila. Magandang araw po. Maraming salamat. God bless us all. We need your prayers. Thank you very much. Thank you.